Hi, welcome to the warm-up series. Good for heart patients, good for knee hip rehab, good for uh, light aerobic exercises just to get you moving. So the first thing we're going to do is seeing if we can just tap the feet. So ankle stretches are good to do if there's any type of knee pain or knee discomfort. People who want to improve their balance, it is important to be flexible with the ankles so that the steps are more comfortable and that it allows bigger steps preventing falls. So we try to do 15-20 seconds each exercise. The first one is the ankle taps. Then you switch sides. It is important to keep moving every day. Our bodies are made to move. Nowadays, where people are staying inside a little bit more, you can still do some ankle stretches, you can still do some movements to help with different types of stiffness in the body. We'll go from the feet all the way up. So from there, you see if you can put one foot in front, moving that ankle forward and back. So it looks like the foot goes forward and back. It looks like the knee goes forward and back, but it all starts from the ankle joint. We're going to repeat all this 2 sets. And then we'll add a bit of arm motions as well. Ankle stretches are good for foot and knee pain. Then you switch sides, other foot, going forward and back. Generally, exercise programs, you start off with some sort of warm-up, something to make the heart beat a little bit faster, something that's light, easy, and then you go into your regular exercise routine. And then you finish off with a cool down. Going into the both feet. So level 1 is 1 foot into a calf raise, toe raise. Calf raises are good for people who are flat-footed, have symptoms or conditions like plantar fasciitis. Level 1 is 1 foot at a time, especially if balance is off. You would do again 15-20 seconds each side. Or level 2, as long as you have some sort of support, you can go into a calf raise both feet. Works balance a little bit more, strengthens the arch of the foot just like the single calf raise. And then we move on to the hips. From there, 1 foot gets pointed up, rotating that hip out and coming back in again. Hip rotation is good for people that have symptoms of sciatica or radiating nerve pain from the hip to the foot. Can be useful to externally rotate for people with hip replacement or knee replacement, as long as it doesn't give extra pain to the knee, or if it doesn't give extra pain to the hip. Then you switch sides. Hip stretches are good to do before gardening. If you know you're going to be cleaning around the house, bending to reach the floor, hip stretches can help before, it can help with making that movement easier or more comfortable. That's hip rotation. From there, you see if you can add those feet planted, hands on the hips, and adding some bends, bending and moving back. So for this one, moving over to the side, you'll see that my legs stay fairly straight and it's my hips that move back. My lower back stays neutral because the hips are moving back. Feeling that in the hamstrings. If you start feeling that in the lower back, instead of leading with your chest, lead with the hips. Feeling the stretch in the hamstrings. Same, 15-20 seconds each side. Yeah. Perfect. From there you see if you can go into a few squats. So level 1 is having a chair there behind you where you can sit on the chair and come back up again. Feeling that in the thigh and hip muscles. Quads, hamstring, glutes, these are the same muscles used as climbing stairs or walking up hills. Or level 2 is without the chair, same form. The knees stay behind the toes. And it's like you're sitting down in the chair. Good for balance, good for hip strength. Always breathing in and breathing out. Perfect. From there we move on to the upper body, seeing if we can go into a few twists. So the hips will stay planted, stomach muscles pulled in, and you rotate the upper body one way into the middle and the other way, going back and forth. Feeling the stretch in the mid to low back and tightness in the ribs. And this is good for shoulder checking, twisting when you're organizing things around the house. Good for neck pain, shoulder pain, and low back pain, being able to twist with your upper back. Then we go into the front shoulder chest. From there, those arms come out, just opening and closing. People that have forward neck posture or rounded shoulders, it's good to stretch the front shoulder chest. That's just a moving chest stretch. That could be a warm-up for wall push-ups, for carrying things around chest level from one room to the other, or carrying groceries as well. From there, those arms relax, seeing if you can reach one arm behind the back, one at a time. That's useful to prevent symptoms of shoulder pain when you reach up high. Sometimes people call that frozen shoulder. If you are feeling excessive pains or pinching reaching the arm behind the back, you don't have to reach as high up. Even reaching to the glutes and coming back is still a good stretch to prevent pain from reaching up high or to the side. Yeah, you do that for a total of 15-20 seconds. Perfect, those arms come down, and then we repeat the cycle. So we did the tapping. Now you can again add those arm type motions. Opening and closing. Good if you are sitting in the couch a lot these days. Nothing wrong with that, but we do get tighter front shoulder chest muscles. Then you switch sides. You can incorporate one arm at a time, reaching behind the back. Just repeating the same exercises we did in the first round, but adding some arm motions. You're going to do that again, 15-20 seconds. Going into that, moving the ankle forward and back, moving that into a push and a pull, going back and forth. Ankle stretches so that you can take bigger steps, good for foot knee pains. And the pushing and pulling so that it's easier for you to push doors, pull things around the house, grocery shop, switching sides, going back and forth. Yeah. Then we went into the hip rotation. This time arms come to the side into a palm up and palm down. Good if there is pain reaching behind the back or up high with the shoulders. You should feel a stretch in the front shoulder, chest, and tightness in your upper back. Then you switch sides. Sometimes people do this and they just move the forearms. You gotta move the shoulders. Palm up, palm down with your hip rotation. (15-20 seconds). Then we went into our bending exercises. Bending and coming back. Feeling the stretch in the hamstrings, strengthening your glute muscles, good for people with lower back pains. 15-20 seconds, and then finally going into your squat motion, sitting down and coming up. Level 1 is actually sitting on the chair and coming back up. The higher the chair, the easier or more comfortable it is for taller people, people with knee or hip pains. Or level 2 is going without the chair. Finally, going back into your twisting exercises, rotating and coming back. And this way we have stretched or moved each joint. Ankle, hip, upper back, shoulders, all the joints that are made to be moved. Some joints like the knee, the low back, they're supposed to be stable, so we don't try to move them too much, but we do move the muscles around them. Ankle, hip, upper back, shoulders. If you're able to complete this routine once a day, you'll at least be able to be mobile in times where maybe we're not allowed to go outside, or in times where you just need to stay home. So that's the first part of the workout series. Try it out. If anything gives you pain, don't do it. And you can always leave comments or feedback. Besides that, thanks.